Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters, a comprehensive chat by the Islamic Medical Association after our seasonal break. This is our first live show, and tonight we will be talking about a different topic, but I'll just introduce you to our guests. Dr. Shoaib Wadi, assalamu alaikum. Dr. Yunus Umar and Dr. Shaira Umar. There's a teaching in Islam which says the best of mankind are those who serve others, and it is one of the principles upon which Muslims should be living. And about 40 years ago, a group of doctors got together in Durban, Johannesburg, and they decided that it is beyond just the normal day-to-day chores. It's like a call of duty to actually serve others, and they formed a little group called the Lajnatul Atibba. And that formed the basis of the foundation for the Islamic Medical Association of South Africa, and they then had a small clinic running in Durban. And it is that particular principle that was a founding principle, is to serve others and to go beyond what you normally do in your day-to-day stream. And although the first group were a group of doctors, it has now expanded over the last 40 years, alhamdulillah, through Allah's mercy, to various and to incorporate various other health professionals, physiotherapists, allied health professionals, dentists. And this show is a collaboration between ITV and the Islamic Medical Association. So we thought it would be appropriate tonight to inform you and also to interact with you about the Islamic Medical Association, its various activities and what we do and what the organization does, but also our collaboration with the community and the interaction with other NGOs and the community at large. So we'll start off by posing our first question to Shoaib Wadi, and perhaps Shoaib will give us an introduction as to what is the IMA South Africa all about.
So I think, Yaqub, you've already enumerated some of the key aspects around the IMA. It's basically, the Islamic Medical Association is a way for doctors to express their Islamic identity and to express themselves as Muslims within the medical field. So, as you know, our Islam and our way of life is not something which we segregate or put to one side. So when we go to work, we leave the Islam at home. Or when you leave the masjid, the Islam is left in the masjid, and you come home and then you do your own thing. It's something which is supposed to permeate and sort of fill our personalities in our lives. So obviously, if you are a doctor or a nurse or a pharmacist or a engineer or a lawyer or a street sweeper, whatever, part of your principles and in terms of your Islamic principles are not going to leave you during that process. So for whatever you do as a doctor, as a lawyer, as a street sweeper, as whatever you are, will be underpinned by your personality as a Muslim, and will be underpinned by your responsibility to follow the commands of Allah subhanahu wa ta'ala and the example of the Prophet sallallahu alaihi wasallam. So look, frankly, it's not easy to do that. I must tell you, we live in a secular, westernized society. We live in a society where the goal is actually sometimes to separate religion from your practice, to make your practice completely secular or completely scientific. Now, and in our sort of consciousness as doctors, as we train, there's almost a dichotomy that you train to understand that the scientific is separate from the sublime, from the religious, and that you separate your science from your Islam. But that's not true. We know that many of the underpinnings of Islam are scientifically based, and that Islam is based on understanding of the knowledge of the truth. So as I said, to do that as a Muslim, to practice, is not easy to do it on your own, and that's where the IMA comes in. It's a vessel to be able to facilitate your ability to practice as a Muslim doctor, to assist you. You can do it on your own. There's nothing which is stopping you. There are many Muslim doctors which do it. There's many Muslim health professionals which do it. There's no association of Islamic street sweepers, but it's easier to do it when you do it together, when you have assistance, when you have an ethical issue or issue which you need to understand from an Islamic perspective, to turn to somebody, to some organization which is going to spend some time looking at it and researching it.
It brings in the principle of shura, which is a very important aspect of Islam, and again, unity in strength.
Yes.
So you can achieve a lot individually, but as a group you can achieve a far more with consultation, discussion, and very well summarized, Shoaib. Jazakallah.
And I mean, just to get back to your point, the goal of whether you're a doctor, street sweeper, whatever you are, is to serve mankind.
Of course.
So you will be doing that even during your normal practice as a doctor. It shouldn't be separate from what you do voluntarily and what you do as your job. But this adds a different dimension where you can do some other work, which is, you're doing it completely voluntarily. You're not going to get any reward in this world for it. And you facilitate it by the assistance of others around you, which make it easy for you to do.
Of course, reward is relative. It's
Yes.
all in the hands of Allah. It's not all monetary
Yes,
and material.
not in this world,
Yeah,
maybe.
yeah. So that's very important. Shada, you want to add a little bit to that,
Certainly,
inshallah?
I liked what you said, serving mankind, and I think what Dr. Shoaib Wadi also reflected on is that speaking specifically to Muslim professionals, allied health professionals, referring to the street sweeper and everybody else. But I think the important message to convey to everybody out there is that serving all mankind, regardless of religion, class, creed, gender, it's all mankind. And poor, rich, the Islamic Medical Association is there to serve not only in terms of health support, but it's emotional support, physical support, even financial support, and the psychological support. So from all spheres and aspects of life, support is provided to mankind.
Jazakallah. Yunus, you've been there from the onset, I think.
Past president, if I may say.
Past president, both locally, regionally, nationally, and it's really been the stalwart for many, many years. Give us a bit of background about IMA, how it's come through the years, the initial opposition to it, and the growth and the maturity of the organization.
Yeah, excuse me. I think you mentioned most of the issues from the historical side, but I think an important aspect that, in addition to what Shoaib and Shaida have mentioned, I think a lot of the value of the membership and belonging to this organization, I found that networking was a very good sort of opportunity. And over the years, you find that you are in contact with health workers from all over the world. This is where FEMA comes in as well, which you probably will touch on later, but that is the Federation of IMAs throughout the world. And I found that this was an excellent opportunity to meet fellow Muslims in all aspects and all professions on a different level than the professional level. And this has been very useful over the years, in terms of my personal growth as a Muslim.
Very important. And what you're touching on, I was supposed to bring in a bit later, but I think we'll just move on to something. This collaboration that we have with the various IMAs throughout the world, there's a Federation of Islamic Medical Associations. But at the same time, we have a convention annually where we try and invite both local and international guest speakers that are not necessarily directly involved as doctors or health professionals, but they bring in another very important aspect, is the bioethical, the spiritual, the moral, and how we integrate these principles in what we do. And that, for people who have attended these conventions over the years, and this year we have our 38th annual one. There's pictures on the screen there showing our guests for this year. Shoaib, you know about them. And perhaps it'll be a good time to maybe just allude and talk about the convention and how that sort of fits in, because it is one of our flagship events.
Yes. So, I think the convention is really, it's an annual event. It's really the event that brought me into the IMA. I'm sure, as Yaqub knows, Yaqub was hosting or convening the convention all those years ago, 2003, and then my wife roped me in because somebody roped her in. And then I got involved with the IMA, and really, and Yunus touched on it as well. You meet a quality of person when you hang around in these circles, and there are many hadith and examples within the Islamic tradition that if you put yourself in certain circles, you're going to meet a certain quality of person. You're going to meet somebody who's pious, somebody who's humble, somebody whose goal is to serve mankind. And there are many people internationally that have been invited by the IMA for their conventions or have come to South Africa as part of FEMA, or even within the IMA in South Africa, who are really unbelievable mentors, examples of how you can live your life in a Western society while still not losing your Islamic identity and doing that. And that's, I think, one of the things that the convention brings to you. And then the convention is a real mix of different things. It's a medical conference on pure medical topics, and sometimes you get insight from top professionals in our field, in different fields in the country, and also some personal insights in how they deal with some of the difficulties they have as Muslim doctors or Muslim specialists or whatever in their field. And then similarly, there'll be a strong spiritual aspect, which is something which is unique in terms of medical conferences. There'll be a spiritual aspect in terms of the Islamic bioethics, the Islamic principles, how to maintain spirituality, how to maintain your contact with Allah subhanahu wa ta'ala throughout the day, and keep the remembrance of Allah subhanahu wa ta'ala foremost in your mind, the importance of performing your salah, the importance of maintaining your responsibility as a Muslim, the importance of your appearance. These type of things are not really something you're going to learn in medical school. There's something you're going to learn as a Muslim, and there are different ways to learn it. But within this career perspective, this is a real learning opportunity. And then, as Yunus put it, it's an unbelievable networking opportunity. And really, this is a family convention. So I know of kids who've gotten married through the convention. Yunus maybe will attest to that. But it's what happens is that families from different parts of the country come through for the convention with their kids. There's a youth program, there's a program for students, there's a program for spouses, there's a program which centers around women's issues, and these are then integrated together with the main program. And so there's some parts which are spent all together, some parts which are spent in individual groups, so people can benefit in different ways. There's programs which are specifically for doctors, programs which are for allied health professionals, pharmacists, dentists, optometrists, and so on. And so it's really a rich and varied program. It's really a benefit to health professionals who attend. I know, we fixated around this thing, we must get our points, because I don't know if the public is aware, but as a medical professional, you need to get a certain number of points every year to maintain your license. It's audited from time to time, not that often recently, but it is audited from time to time. But what happens is that we get fixated around, I must get my points, I must get the ethics points, I must get that. You'll achieve that at the IMA convention, no doubt. You get almost all your points for the year, but you get so much more. It's just, even I normally get my points long before the IMA convention, but I'll still make an effort to go every year, because the value that you get is just something completely different.
And you can't really measure that value, and we'll discuss further. An excellent introduction to the Islamic Medical Association of South Africa. We'll take an ad break, and then we'll come back, inshallah. Assalamu alaikum. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. Tonight we're talking about the Islamic Medical Association of South Africa, an informative program. We'd like you to interact with us when the lines do open, and the number will be on the bottom of your screen. We had a very good introduction before the ad break, but I now want to talk about specific projects. And there's so many, but Shaida, we'll start with you. And there's a project that IMA is involved in quite integrally. It's called the Muslim AIDS Program. And I'm not too sure how many people know about this program, but it's an excellent program.
Okay, so the Muslim AIDS Program has been in existence for the past 20 years. You're absolutely correct. The Muslim AIDS Program works very closely with the Islamic Medical Association, the Islamic Care Line, and the Jamiat office. And I think what is important to appreciate and recognize that in the 20 years, they have grown exponentially, that we have projects and programs running in the different provinces, firstly in the Western Cape, in Gauteng province, in the Northwest, and KZN. And the programs focusing on awareness and education, a lot of awareness and education being rolled out at schools. And if one actually looks at the year 2017, the number of outreach or the people that they reached out during the 2017 year period was over 123,000 people. So MAP also works closely with IMA regarding the health screening days, where they provide the routine TB testing, HIV testing, and it's also encouraging people to be tested and making them aware around the risky lifestyles. The one program that they're running at schools is the abstinence program, with, you know, it's an unapologetic approach to abstinence. If we look at the secular approach, or the other schools' approach is condomize, and of course MAP is recognized for not accepting or conforming to that norm, and that has proven to be very successful. But the rollout also focuses on teenage pregnancy, so other social ills that we are faced with within our societies. So it's substance abuse, which is of course also related to a risky lifestyle and increases the risk of HIV infections. And something that MAP has focused on is the promiscuous behavior by the youth, because there seems to be a leaning towards that and an increased incidence of HIV in and amongst the youth. So MAP has been proven to be very successful because they also do the pre-test and post-test, and there are longitudinal studies that have been conducted which has indicated that there is an increased incidence or reduction in the prevalence of HIV. And if we look at the levels of knowledge, the knowledge base before and after certainly has been more positive. But it's also working with the stigma. You know, a lot of stigma is still associated with HIV. So it's addressing the issues around stigma and encouraging people to be, of course, tested. And I think that's one of the things we also want to alert the viewers to, that it's not something that one needs to fear, that when these health screening days are made available to the public across the country, people need to use this platform to go and be tested.
And it's an excellent opportunity to actually get screened. And also, so Shada, one more thing, the Muslim AIDS program obviously is a Muslim name attached to it, but you obviously offering the service to everybody. I
think you've touched on something that is so critical. If we look at the Muslim AIDS program, it's run across the spectrum, regardless of race, religion, class, creed. And of course they work with orphans and vulnerable children, working with both infected and affected populations. So working with not only with a person that is infected or affected, but with the broader context, the family, and even going broader, schools, other organizations, civil society partners, medical professionals. So it cuts across the different sectors and working intersectorally, like working with faith-based organizations, using the Jamiat as a good platform to reach out to the Muslim community, but they're reaching out beyond the Muslim community, and I think that is very important.
And the outcomes you've measured are showing positive results.
Positive outcomes, the evaluations definitely, it's evidence-based.
If I may come in here,
yeah, sure.
I mean, I think one of the goals of the Muslim AIDS program and what sets it apart is you mentioned that the care is across the spectrum of all South Africans, of people, even foreigners and people who are affected or infected or who have suffered from many of these ills. But the approach is an Islamic one.
Yes.
So it's a form of dawah, it's a form of education, that there's a different approach to the Western approach of just, as Shaida said, condomize. And in fact, it has an effect. So even the government, after some time, realized that you can't have an approach of just condomize. They added abstinence into their own program as part of an understanding that if you teach a child to rather save yourself, stay abstinent, even if they don't have a religious motive behind it, it has changed their behavior and the understanding that there is value in adding this. So I think that's useful.
How does the government view this map?
So I think Yunus has asked something very important. And the National Department of Health has recognized this. They've applauded this, the MAP program, and they have commended it highly for the outcomes reached and the approach that MAP has adopted over the years.
And I just would like to, on behalf of the IMA on this platform, thank those who are heavily and deeply involved in it, like Auntie Shaida herself, Auntie Suraya Nawab, many of the people from the Islamic Airline, the Jamiat, including the support you get from the Jamiat, from high up in the Jamiat, the very leadership of many of the ulama have been involved. So this has really had a lot of support.
Collaborative effort, and you got the spiritual side, you got the ulama involved, you got the medical, the scientific, you got the social, the psychological. So it's truly comprehensive and holistic, and IMA fits in pretty well in that whole program.
So it's a very comprehensive, integrated program, not working in isolation.
Which is important. The lines are open. Please do call. The number will appear on the bottom of your screen. If there's any questions you want to ask about the IMA, not necessarily what we've discussed to date, because we can answer, and we have three important stalwarts of the IMA, so please feel free to call us. We spoke about the history, Yunus. Now we must talk about the future. And the future is the young blood that we want to bring in, and we've made some efforts over the years to try and encourage the new young graduates. And one of the activities that is the catalyst towards that, we host the IMA graduation annually. And Yunus and Shoaib, you guys want to discuss that?
Look, basically I think that is one of the highlights in the calendar of the IMA. And I think students in the past, it may not have been very popular, but now they actually look forward to this event. And especially the parents, in fact, get more excited than the students themselves. And I think that people have been conscientized now to say that, look, the Western graduation is one thing, but they put more value, I think, into this Islamic type of graduation, because they find that it's more acceptable with the community and their families, whereas the Western one is sort of a bit more on the academic side. So I think that this is a very useful way of roping in future membership for the IMA. And I think we should continue with that as we are doing, and trying to, in fact, improve on it in the future as well.
It also gives them a taste of what we're about, and at the graduation we try and give them a broad overview what the organization is about. You want to add to that, Shoaib?
I think, obviously, students have got their own structures because they live almost a separate life from professionals during their student life. So there are many student organizations like the Muslim Students Association, the MSA, basically. And during their medical school years, many of the students who are highly politically active or highly conscientized, who are social activists, came to the MSAs. And I know you remember from your time in medical school, those are the people who came through the MSAs. And the IMA can be a natural continuation of that. Many of them are involved in the IMA through the MSA, so we engage the MSAs at all the universities. The MSA and the IMA student sort of wing is like a single entity, essentially. And then the idea is to get widespread student representation at the convention, especially for medical students. So this will be a focus around medical students or students in the health sciences. And it's an introduction to get them into that type of mindset of serving the community and giving back, being surrounded by people who are doing that.
Let's take an ad break and we'll come back. Assalamu alaikum.
Carpet City has been installing musalla carpets in masjids, madrasas and jamaat khanas for over 15 years, providing a complete turnkey operation from design and color choices to installation and after-sales service. We have an extensive range of designs and colors to match your taste. Let our professional team assist you in choosing a musalla that suits your budget. We service clients across the country. Call us now for a free, no-obligation quote on 021 633 8222 or email us carpet@mweb.co.za. Carpet City, your professional musalla carpet company.
Help Heal Syria with the Africa Muslims Agency's mobile clinics. Many of our Syrian brothers and sisters are displaced and in urgent need of medical assistance. The Africa Muslims Agency's mobile clinics provide free medication, professional maternity and pediatric care. Give our Syrian brothers and sisters hope by donating any amount now. Contact AMA on 011 834 8685. Africa Muslims Agency, continuing to empower humanity with dignity, inspiring the spirit of giving.
So Mom's Kitchen needs a container makeover. Something fun and colourful for the kids. Or maybe Dad's garage needs to get into shape. Just Plastics is the A to Z of local and exclusive imported plastic products and more, all under one roof. Get great value with a gift card or Red Rewards loyalty card and get rewarded for every purchase. Check out justplastics.co.za for great value, widest range, and right price.
Welcome to Star Meats in Durban. Here you will find out that service is not a thing of the past. You will find a great store featuring unique and specialized items from bakery to frozen foods, canned goods, sauces and marinades. Our meat selection features the finest chops, steaks, mince and chicken pre-packed and cut to order, with a vast variety of marinated meats for that perfect braai. Star Meats, committed to quality and freshness for 60 years.
Trend, Tap and Tile or Monday. Your home, our passion.
Assalamu alaikum wa rahmatullah. Welcome back to Health Matters. Today we are talking about the Islamic Medical Association and the various aspects the organization is involved in. We will be touching now on the different programs. But Shada, we're talking about the students. You wanted to make a comment and then we'll move on to our different projects. And the lines are also open, so please do feel free to call in.
I think both Dr. Shuaib and Dr. Yunus alluded to the fact of the importance of the graduations, recruiting the students, but I also feel that the IMA, in terms of the future of the youth or the incoming new graduates, I think this is an ideal platform for them to be inspired, to be motivated and encouraged to actually go out and roll out services, because they learn from the stalwarts, learn from existing programs, and they see the merits of it, and they also experience the payoffs. The payoffs are not in terms of monetary terms, but the inner fulfillment and the rewards that it actually reaps in reaching out to others, because there's more good in giving out than receiving. So I think this is an absolutely excellent platform for our new graduates to come in and move forward.
Inshallah. I mean, we're going to move on to some of the projects, our collaborations with different NGOs, our networking, our partnerships. The first one I would like to touch on is our cataract program. Sure.
So, I mean, the cataract program exists in different ways in different areas of the country. In Gauteng, we've had a program on ITV about the cataract program before. Yeah. It's run by Dr. Shabir Hussain, well assisted by the Pakistani community. And it's a sort of partnership between the IMA and the Pakistani community. And we have several partners who come along and assist over the course of the year, like OCAF, Sultan Bau Trust, certain individual families like Dr. Harun David's family, and so forth and so on. So there are lots of people and individuals as well who then sponsor. And then this program really is able to do cataracts in collaboration with the government. So it's a partnership with the government as well, using government facilities and government hospitals to reduce the waiting list among patients on the government waiting list. So for example, at Sebokeng, where there was a year's waiting list for patients who are bilaterally blind. That means people who have cataracts in both eyes, they can't see a thing for a year. They must wait. So Dr. Hussain initiated a program where we started with 10 a month, and then every few months they would do 100, a camp of like 100, get a few ophthalmologists together to volunteer their time, anaesthetists, they pay the nurses and some of the support staff at the hospital. We raise money to do that, and then within, I think, 6 months they had eradicated that waiting list. So now if you go into that hospital and you need a cataract operation done, it can be done in the same week. Similarly, they went to Laratong, and then once word spreads out that you're not going to wait so long in this hospital, patients redistribute, and it actually has an impact on the waiting list throughout the province.
And on the hospital itself.
And on the hospital itself. So it's made a big impact. Obviously, cataracts are a simple thing to do. There are more complex projects which are harder to do and harder to achieve. Well, I'm saying simple. I'm actually belittling or undermining, undermining the hard work it takes and the work that Dr. Hussein
and the consumption of time.
So
the figures now are that they're reaching close to 5,000 cataracts done over the last few years.
Also, I think you should mention the cost factor, because that is quite a significant factor.
So I think to do a cataract in the private sector probably costs around 10,000 rands. These cataracts are funded at a level of about 1,000 rands a cataract. But obviously, using the state facilities with the assistance, the 1,000 rand is used to buy the lens, to buy a little bit of equipment, and then to pay the nurses and so forth. And then every patient gets a gift, which is a form of dawah. They get a little bit of a gift. They get an English Quran. They get a little talk about what Islam is about, and so on. And that's phenomenal.
And
the
they get exposed to the humanity amongst Muslims. At the same time, it's a true example of a true public-private partnership without a commercial angle to it. So there's a lot of other spin-offs. And again, so it's a very positive thing.
And Gauteng is not the only branch which is doing cataract. They've done it in Klerksdorp. We did it in KZN. It's been done in Cape Town. So around the country. And I mean, cataract programs are run by many organizations. It's a well-recognized need throughout South Africa and throughout Africa. And I think it's just one way that the IMA contributes amongst many ways.
I think it's a real eye-opener.
On that pan, I also want to just add, I think that what Dr. Shoaib spoke to, that it's not just looking at the medical intervention, it's looking at the food for the soul, but it's also providing food for that person that actually comes in, because they have lower order needs. So addressing the higher order needs, but also addressing, giving them refreshments and food. So I think the complete dawah approach to reaching out to a patient in need.
And just the restoration of sight. I mean, life, I mean, that in itself, and we see that amongst the people that are attending those graduation ceremonies, the gratitude, not that we want gratitude, but just the mere fact that they can appreciate that this organization has come out to assist them without any reward being sought. It's very, very important.
I think the compassion that is demonstrated, the compassion, the kindness.
And I mean, one must take our hats off to the ophthalmologists over the years who have donated the time. Dr. Shabir Hussain and his team, some of his colleagues, his friends who come out regularly on a monthly basis and then annually for a couple of camps, and they've done unbelievable work over the last 10 years or 8 years or so since it's been running.
One of the most important projects that IMA does since its inception is the clinics projects. And we started with that in KZN at the time, 1979, 1980. Then we had in Gauteng, stopped for a while, moved on again. Then we've had now in Cape Town, we've got the one at the mosque in Soweto, Roshni. Amazing program. Any one of you can perhaps just talk about the clinics?
Well, look, I remember from those years, you know, the clinics was like the pet sort of project of the IMA.
Yes.
That was a founding project, really.
Absolutely. And in fact, the government actually took inspiration from our clinic project in
primary healthcare
in KwaZulu. And some of the chaps who are involved there really have been dedicated over the years. They've really put in, you know, a lot of effort and sacrifice into this. And it's been a sort of unpaid job, really, if you look at it that way.
Yeah, and in many ways it's an under the radar, because you're treating simple conditions, you're not doing these high profile operations, but the quality of life that you're offering to people who just want simple care, and it's quite widespread, and we have a national footprint in this regard.
The clinic is usually in a poor area, an area of need, so it's not something that...
Bringing in accessibility.
Disadvantaged population groups have access and availability to such a needed and valued resource.
Yes. I mean, I think one of the things about the IMA also is that the idea is not to be competitive with the government, so we don't want to duplicate or embarrass the government or make them...
it's more to augment.
It's to augment and to facilitate and work together with other role players, and also not to supersede the work that other general practitioners, our colleagues, are doing, but to perform a service where there's an area of need. So I think that's an important thing. And obviously, sometimes you get opposition because some doctors may feel you're competing with me, and so. But really, the the type of patient that the clinic is aiming for are really people who are truly indigent, who are usually stuck in long queues at government clinics and so forth. And to try and shorten those queues, try and assist the government. And also, going through those clinics, there's also different elements of Islamic akhlaq and other things which these
Similar
patients are exposed to, and they see things from a different
Maybe
perspective.
at this point we could bring in the screening, you know, that we do.
Yes.
Which
We'll just take
augments.
an ad break and then we'll come to that. Assalamu alaikum. Assalamu alaikum wa rahmatullahi wa barakatuh. We'd just like to apologize to those viewers that called in. There was some technical difficulty and the call couldn't be put through to us. So please accept our apology. We'll continue with our discussion on the Islamic Medical Association. We're in the last segment of our program. Time has gone on pretty quickly. So we've had clinics, cataracts. Another one that the community that should be aware of, and some people are, is the amazing dialysis work that is being done by the various centers.
So I mean, I think in Durban they really spearheaded this project, and they've developed a model which can then be replicated and done around the country. Now, obviously, I mean, I think we've touched on this before, that dialysis is a limited resource and not everybody can get it amongst many resources in the country. And this is a way to increase the accessibility so that people who may not be able to access it in the public sector because of limited resources can try and access it through the private sector or through the NGO sector, so that they can at least continue living and continue interacting with their families and so forth and so on. And the idea is to get more and more people which will benefit. I think obviously the organization has done it in different ways around the country in different centers with different partnerships, but the model is relatively similar. And the idea is to try and get more and more people who would be turned down for dialysis, and this is regardless of race, religion, creed, wealth, and so forth and so on, if there are funds available, and also if the person fits the clinical profile, is not sort of a terminal type of person, that we try our utmost to assist that type of person to get access. And it's really had an impact on dozens of lives, maybe even hundreds of lives around the country now.
And people who want to contact or access this particular service, should they contact the IMA office?
So I must be honest, this program is now well known amongst the public hospitals. So for example, if you're in a public hospital in KZN or in Gauteng and your kidneys are failing and they don't have space for you, they will contact us now.
Is it?
So the public hospital will say, this is a facility which may be able to help you. This is their contact number. Let's get hold of them and see. So often, and I mean, one of the mechanisms that we use is that the person has to come through the public sector, because they actually then support us. It's a partnership again, together with the public sector.
And the various screening procedures have been done.
And then also the public sector assists with screening procedures. Because sometimes the kidney failure is reversible. And can be treated and will reverse. The person won't need dialysis long term. And sometimes kidney failure is just part of the problem. The person's got some other severe, incurable problem, and then you need to actually discuss whether dialysis is appropriate. So there are many, many aspects which need to go into it. And
sure, Yunus?
Sure. Maybe we should mention the screening that we do, you know, and I think next month we're doing 2 screenings.
So that I want to just link it up with our frail care, because, you know, we have an aging population.
Right.
And the trend today is it's very difficult now for the old to be cared for whatever reason. And that's a reality of life. So we conduct screening programs for various people, but also the chronic diseases. And then also we have a frail care program. And maybe we can talk about both together, Shaira.
Okay, so if we look at the frail care program, Darul Shifa, and I think Nazreen Mutara, who's spearheading the frail care to people who are really frail, and the elderly, senior citizens who need home help, who actually don't have access to resources and equipment like wheelchairs, and who need home help care, where they're not in a position to bathe themselves or feed themselves or dress themselves. So the Darul Shifa provides that kind of support, reaches out to people within their own environment and trains helpers to go in and reach out and provide support to the frail, to the elderly, to all those persons with disabilities, persons who need any kind of equipment in terms of whether they need, besides a wheelchair, a walker, any kind of aid to assist to mobilize them. So that is something that has been very, very well received by the community. I think it's a growing need, and there's been a lot of education and awareness around this. A lot of training is provided to these home helpers who go out and reach. A lot of supervision and monitoring of that support is also rendered. But I think we also need to realize that previously, we know that this actually falls under the ambit of the Department of Social Development. Now, there are many NGOs that are providing this kind of support. We can look at the Methodist churches, Vroue Federatie, and a lot of other NGOs that have been providing it. But it was previously very white orientated and provided specifically to the white population group, whereas with Darul Shifa, it's non-specific. Yes, it's Muslim based, it's coming from an Islamic perspective, but it's reaching out to all those who need this kind of support and care.
I must say once more, I mean, it's another example of a partnership. So, I mean, within the Fair Care program, it's not done in isolation, and there's a recognition within many spheres. Many Muslim bodies have now understood that there's this specific need within the community, which, as you say, historically may not have been as acute, but has become acute for a variety of reasons. Maybe the way our society is dispersed, the fact that people don't all live in the same area. Maybe the son lives in Benoni and the daughter lives in Greenside and the mother lives in Lenasia, and it's those type of issues that have a serious impact on the care. Or sometimes that's a small example. Sometimes the mum lives in Benoni but the daughter lives in London, and the other one lives in Canada. So these are serious issues, and working families, so they've affected it. But what I was getting to is the partnerships are incredible, and I mean, Nazreen will tell you they work with OCAF, Fountains of Inspiration, the Jamiyat, with Darul Shifa, which is a branch of OCAF and IMA, working together. So there are multiple issues, and in Durban, IMA Baitul Noor has specifically performed this function for many years, and Sister Hani Ali's spearheads the training of sisters and home-based carers and so forth. In Cape Town, they're trying to initiate a rolling project to do this as well. So there are many, many things happening, and I think one of the things which the IMA has really been good at, and I mean, I'm actually quite happy to say this, and it's maybe better than many other organizations, is collaborating with other organizations.
And the collaboration actually reaches out to many in dire straits and in need, because just giving a simple example, if somebody needs a commode or they need a wheelchair or they need a walker, people that don't have access to funds, this is their ideal platform to get that kind of support.
Jazakallah khair. We've actually reached the end of the program, we may have to conclude in the next 30 seconds.
No discussion is complete without mentioning the founding father of this organization, Brother Ahmed Al-Qadi, and also the hospital that has been built in his memory.
We'll obviously talk about that the next time we have come to the end, inshallah. There's a new hospital that's been built in KZN through the IMA South Africa, named after the founding father of this organization, Dr. Ahmed Al-Qadi, and inshallah we'll have another program because we have a lot more to talk about. But the IMA South Africa, the one that's hosting this program, has a lot to offer to you, and if you need any further information, please go onto the website. We do have a website, and for all those that want to attend this year's convention, we urge you actually to register early. And Jazakallah khair for your viewership. Assalamu alaikum wa rahmatullahi wa barakatuh.